Firstly, I would like to thank Helen and everyone associated with AMMF for inviting me to speak today and for the incredible work they continue to do for people living with cholangiocarcinoma and their families. When I was preparing this presentation, I was asked what the title of my talk would be. I said it's difficult to sum up what I've gone through in a title, and I couldn't think of anything better. However, I do have some time to sum it all up now, and I will do in the next few slides. My name is Gareth, I'm 31 years old from Doncaster, and my day and night job is a maxillofacial surgeon. While preparing for today, I looked back through photographs from the last 3.5 years, trying to piece together everything that had happened since my diagnosis. One particular photo stayed with me. It was taken on a Friday morning in the canteen at the Royal Hampshire Hospital in Sheffield. I had just finished 4 consecutive night shifts, and the consultant on call was buying breakfast for the team. It stands out in my memory because later that day, England were playing in the USA in the World Cup in Qatar, and that evening I was going to see the band Blossoms with my parents. This day summed up who I was at the time. I worked hard, I made sure I enjoyed life, football, music, family and friends. What I didn't realise was it would be the last night shift I would ever do, and I wouldn't return to work for 7 months. Over that weekend, I spent most of my time curled up in pain with severe upper right quadrant pain. On the Monday morning, I phoned my liver specialist nurse, who I had contact with because I had a diagnosis of PSC. They admitted me straight to hospital, and I spent the next week being treated for cholangitis with antibiotics and IV fluids. The months that followed are difficult for me to reflect on because my memory of the time is patchy. People talk about trauma blocking, your brain protecting you by blurring memories, and I think there's truth in that. What I do remember is pain, urine the colour of black tea, nausea, weight loss and jaundice. This photograph was taken less than a month later than the previous one. You can see how well I looked. In January 2023, I underwent an ERCP to attempting to stent my bile duct to treat the jaundice. After several attempts, the stent was placed. The notable line from the ERC report, this was a difficult ERCP. In February 2023, I underwent surgery to remove a stricture in my bile duct, which was later confirmed to be cholangiocarcinoma. During that hospital stay, I learned to celebrate small wins, every drain removed, every tube taken out the day I got to go home. My favourite photograph from that time is actually one of the simplest. It's me wearing a shampoo cap that somehow managed to wash your hair while also making you look like a chef. This photo is my impressive scar. It took me several days to even look at this wound, but now I look at the scar differently. It's a permanent reminder of the things that saved my life. I then went on to have 6 months of chemotherapy, and in September 2023, I was told there was no evidence of disease. My oncologist said they hoped to never see me again. After everything I'd been through, I wanted to give something back. So in December 2023, I decided to perform stand-up comedy for charity and managed to raise over £1,000 for AMMF. This was my first contact with AMMF, a charity now close to my heart. Looking back at 2024, it's difficult to know what to include because there was so much life packed into it. Holidays with my partner Beth, with my mum, dad and brother Danny, concerts and seeing Taylor Swift with friends. Watching Doncaster Rovers with my dad, a stag do in Prague, and a proud moment in my life, being best man to my friend Dan. The 30th of August 2024, I attended another concert with family and friends, but this time things were different. 3 days earlier, I'd been told that an MRI scan showed my cholangiocarcinoma had returned. I had no symptoms at all, and it reinforced just how important regular surveillance and imaging is. A few weeks later in September, I travelled to Rome to present a poster and oral presentation at a conference. In many ways, it became a welcome distraction before the next stage of treatment began. In October, I started chemotherapy and immunotherapy, and I had no idea what to expect, but I never allowed myself to lose hope. I just tried to take each day as it came. In the following months, there were inpatient admissions, missed doses, episodes of cholangitis. It was hard. It was really hard. And again, much of that time feels blurred in my memory. But I got through it in the same way I've tried to get through everything else, with humour, with family, and by finding moments of normality wherever I could. Simple things like a laugh with my brother. Although I've told my story chronologically so far, I want to go back briefly to August 2024, after my recurrence. After speaking with those closest to me, I phoned Martha at AMMF. The moment I told her about the recurrence, she dropped everything that she was doing. Very quickly, I had an appointment arranged with Professor Bridgewater, and at that appointment, I was offered the opportunity to take part in the AVC10 trial. Of course, I said yes. For the first 3 months, I received chemotherapy and immunotherapy at my local cancer centre in Sheffield. As I've said, it was incredibly tough. One thing nobody tells you about chemotherapy is the sheer volume of fluid involved. Before you experience it yourself, you imagine chemotherapy as sitting quietly in a comfy chair, maybe drifting off to sleep. In reality, with this regime, it was about 4 litres of fluid. You spend most of the day walking back and forth to the toilet. While all of this was happening, my tumour samples were being analysed around the world for molecular profiling and mutations. Then came what turns out to be one of the most important appointments of my life. Professor Bridgewater told me I was suitable for a new drug called zanidatamab because my cancer showed a HERS2 amplification. The chemotherapy had stabilised things, but naturally, I wanted to see what this new treatment could do. I started zanidatamab in January 2025. On the trial, it meant CT scans every 9 weeks and travelling to London every 3 weeks for treatment, over 4 hours drive from my home. It wasn't easy, but I felt incredibly fortunate to have access to it. I tried to make the most of every trip, exploring London on the better days, finding moments of normality in between appointments. Then scan after scan brought better news. The tumours were shrinking. By September 2025, there was no evidence of active cancer. Even better, the trial had expanded beyond London, meaning I could receive zanidatamab just 15 minutes from home in Sheffield. There were still challenges, gastric bleeds, low phosphate levels, but compared to chemotherapy, it felt manageable. The next chapter became trying to help get zanidatamab approved by NICE, so other patients could benefit too. After the first consultation, it was rejected. Therefore, a media campaign led by MMF was launched. In March 2025, I did the cliché cancer patient trip and went to Disneyland. A testament to zanidatamab that I was able to do something unthinkable on the standard care of chemo and immunotherapy. I returned to Rome, this time purely for a holiday. I went to Wembley, I travelled, I lived what felt like a normal life again. But the highlight, something I generally didn't think would be possible, was travelling to Australia to visit my brother, who had temporarily moved over there. We made unforgettable memories together, including watching England get absolutely destroyed at cricket. And thanks to zanidatamab, I can also now say I have a photograph of an emu. I'm proud of many things in my life, graduating from university, my day-to-day work, raising money for my MMF. But the moment I received the email saying zanidatamab had been approved by NICE is probably the proudest I've ever felt. I played a very, very small role by submitting a patient testimony, but knowing that other people may now have the same opportunity I was given, the opportunity to extend life, to create memories, to live their own version of normal, means everything to me. At the beginning of this talk, I didn't know how to title my experience. I still don't. But there's a title from a book by the Pulitzer Prize-winning writer Mary Schmidt, and that stayed with me throughout. The title of the book is Even the Terrible Things Seem Beautiful to Me Now. That perfectly captures how I feel as someone living with cholangiocarcinoma. Being diagnosed with cancer at any time is terrible, but being diagnosed at 27 with a cancer known for poor survival rates was terrifying and still is. And yet, when I look back now, I don't just see an illness. I see the people I've met, fellow patients, clinicians, researchers, nurses, AMMF staff. I see concerts, holidays, football matches, walks, cups of tea before appointments, laughter on difficult days. I can look back at moments that have fallen in my favour. If I didn't have the diagnosis of PSC, I wouldn't have had the direct line to a liver specialist nurse to contact when I wasn't feeling right. If I'd had to go via my GP or A&E, would the delays led to delayed surgery, or would I have even been eligible for surgery? If I didn't have the MRI when I did, would the reoccurrence have been too far gone? If I didn't decide to raise money for AMMF, I may not have had the contact to be able to contact and get a quick appointment with Professor Bridgewater. There's a lot of what ifs, and I feel lucky that these fell into place. In NICE's final report, they estimated that around 60 patients per year may benefit from zanidatamab. But those 60 patients are not statistics. They are somebody's mum, dad, son, daughter, partner, friend. And what you're giving them is not simply more time, you're giving them the chance to experience life. Not just the big photo-worthy moments like Australia, Disneyland, or seeing Taylor Swift, but the ordinary moments, dancing in the kitchen with your partner, ordering a takeaway and sticking the TV on in the evening, going for a walk around your local park, having a hot drink and chat with your family. Moments that sound small until you realise they're actually everything. Because of surgery, because of research, because of new drugs, because of clinical trials, and because of organisations like AMMF, I've been able to keep living those moments. And that's what makes life beautiful, and I'll be forever grateful for mine. Thank you.